So what I'm going to do is get started. We use a sterile technique, and the key to being good at this is really having a tremendous knowledge in anatomy, knowing where your anatomical starting and end points of all the structures of the body, including the muscles, the nerves, and all the different structures of the body. So I'm going to just get gloved up. I'm going to prepare the surface, and so we're going to start by opening up the needles. The needles are obviously sterile. They come in a sheath, and the technique that you're performing, and I'm going to start by performing this technique on the spinal area, palpating. I'm feeling the spinous process, and I'm going to perform the technique next to the spine at an angle where it hits the transverse process of the spine. Okay, so we're coming in. The way you put the needle in is you pop it in quickly, patient doesn't feel anything, and then we're going to just slide that needle down till it hits right there. I've hit the bone, and I'm going to leave it right there. Pretty much pain-free. So what I'm going to do is I'm going to just go at different levels. So right now I'm at about T5, T6, which is the fifth, sixth thoracic vertebra. I'm going to go in at T3, and then we'll just keep going up. And that was T4, T3. Very painless technique. And we'll say put 4 needles in the side. And each one of them is bumping up against the bone. So what I'm doing is I'm going through, if you look at what it looks like, this is your spinous process, this is your transverse process. There's muscle that sits right in this area. I'm taking that needle and I'm inserting it right in like that, bumping it up against the transverse process through about 6 layers of muscle. And patient feels very comfortable. There's no pain. If you take a closer look at the surface, you may see some redness forming around the needle. That is exactly what we're looking for. We're looking for increased blood circulation around the needle. We know that increased blood circulation heals, and it causes those muscles to release over a period of time. I'll usually leave these in for 5 minutes, very comfortable. Patients usually just relax without any problems. So I'm going to take these out now, and then I'm going to show you a couple different techniques that we do. So bringing out the needle. What you can see is, there's no bleeding, and the surface is pretty clear. Only thing you can see is some redness, and that is exactly what we're looking for in the healing process. So once again, if I was doing this, I would do both sides of the spine, and I could go as far down as I wanted. The advantage is that now what I've done is I've taken those muscles that were spasming and the spinal pain that she had and reduced that immediately, and that has profound effects on the patient's pain levels.